So if you're 42, you're doing bicep curls and you are up to 25 pounds, that is amazing. Might I challenge you to start doing a mobility routine? So instead of thinking, what muscle gains can I gain? What if you thought about what joint mobility, what movements can I gain? Now, there is something about that you might not be thinking about. If you can improve the mobility of the joint you are working on, let's say shoulder, elbow, wrist, if you gain more motion, you might be able to gain more strength. Now, 25 pounds isn't anything shabby, and that's pretty awesome. But what if we talked about things more like power? What if you did combination motions? What if you did a Turkish get up and go? What if you changed instead of just a more static, but added a more functional movement? Those are the kind of things I talk about with my patients, because if we push it too hard and we don't do the mobility training, this is when the tendonitis and joint pain comes on. Specifically, when you're lifting heavy weights, you can get pinching in your elbow because your radial head doesn't have enough ability to move and spin and glide, and sometimes those nerves coursing through that area can be pinched. Or people can have lateral epicondylitis and tendonitis because they don't have full motion. So I'm always recommending functional range exercises called CARs, which are controlled articular rotations. So I recommend to my patients thoracic CARs, shoulder CARs, scapular CARs, elbow CARs, wrist CARs. And instead of thinking only about the strength, think about the full range. And then once you have more range, you might gain more strength. And then after that, what if we had power?